I'm not afraid about it in taking care of corona positive patients. All staff nurses are risking their own lives. She initially had symptoms and she spread the symptoms to the kid, which is less than 3 years, who is less than 3 years old. And I realized it spreads very fast. Hi, I'm Mohna Balasamy, one of the registered nurse working under Sheffield Teaching University Hospital.
How many positive suspected cases you have taken care of so far?
As of now, I am taking care of more than 8 positive cases, and suspected cases is more than 20. And moreover, for all patients, we are just following standard precautions like using apron, gloves, and face mask before touching the patients, and before entering the patient cubic as well.
How did you feel when you first heard that you're getting COVID 19 positive admission or assignment?
See, actually, I thought, is it the coronavirus of Middle East respiratory syndrome? Because in the year 2015 or 2016, actually, I don't know. I didn't remember that. During that time, there was an outbreak in Kingdom of Saudi Arabia. I was an infection control nurse at that time. So initially, I thought, are they talking about this coronavirus? And later, I realized, and I read about the strains of COVID-19 that it's not the same, and it is actually it has a huge difference between them. There is a huge difference between them, and I realized it spreads very fast, and it has different signs and symptoms, and it is really a big difficult task for the nurses to take care of such patients.
How did you feel when patient had bad prognosis?
The bad prognosis, especially those people who are respiratory complex, has been taken care by ITU nurses. So there they are providing their maximum support and strength to take care of such patients. Like they are putting the patients in prone ventilation, HF, and so many. They are taking maximum effort to take care of patients. I know certain patients with some comorbidities are dying, and as of now, how many deaths has happened in my hospital, I really don't know. But I feel that it is not huge enough.
Do you have any experience with COVID 19 positive patient which affected you deeply or emotionally? Please share.
See, one of my colleague who suffered with corona positive, she's a registered nurse. She worked together with me, and she developed symptoms of fever, headache, body pain, and there was no any respiratory symptoms. She's staying with a 3-year-old kid and husband in a house, and she initially had symptoms and she spread the symptoms to the kid, which is less than 3 years, who is less than 3 years old, and the kid developed fever, body ache, and actually, and even the husband developed symptoms. So it was a stressful situation for my friend to take care of all two of them, as well as she's also having symptoms, right? She's also having cold, like a body ache and fever and everything, right? And she can't go out to buy necessary things or any groceries or any vegetables or fruits, whatever she requires, even the medications, right? So we used to buy and give her certain things, and we'll just keep outside our house and come back. And you know what? Her incubation period was over. After 14 days, she came for work, and now she's taking care of positive patients, and her husband supports her very well. And I'm really appreciate her concerns and her I really appreciate a positive spirit to take care of corona positive patients.
Did you have any problems with getting PPE? Have you ever felt that your work is dangerous right now?
And all staff nurses are risking their own lives. I used to feed the positive cases of corona patients, and I need to make a close contact with the patient as well. And moreover, they are very elderly. See, I'm not afraid about it in taking care of corona positive patients. It's all depends on how we are following the infection control practices, especially dunning and duffing effectively or not. Since my hospital is a teaching hospital, as I said before, they used to update about PPE measures every day in the morning, and they they categorize it effectively, like how long you're going to stay with the patient, and If it is for less than a minute, what are the PPE you have to wear? And if it is more than a minute, if you're going to assist with aerosol procedures, what are the PPE you are going to wear it? So they just make a guidelines, and they place the, I mean, even the stickers they printed and place it in outside the cubic of each bay, so the nurses can view it and can do the dunning and duffing effectively by seeing that.
What did your family say when you're going to work? Did they ask you not to go to work, or they're proud of you for going?
About the family, everybody is afraid about COVID-19, and all wants to live and all wants to stay in this world. So all family really afraid about the what will happen to their daughter or son who is going to take care of COVID-19 positive patients. I used to call my parents once in a week before. Nowadays, it's mandatory for me to call twice a day. They won't hear my voice because it's frustrating for them as well, right? Because we are taking care of COVID-19 patients. That's okay.
Are you distancing yourself from your family when you go home because of fear of spreading without knowing?
See, my housemate developed COVID-19 symptoms, and I have to stay with her in a same house. It's been 14 days now. I didn't develop any symptoms yet, but since because we are following the social distancing as well as hand washing. That's the effective measures to combat any kind of viruses, bacteria, any other things. So hand washing is the best way to combat any other infection.
What medications or measures do you think is helping patients who got cured?
About the medicine, symptomatic management is the only measures take care of those COVID-19 patients. More than that, I feel like these patients require emotional support because they are emotionally unstable. They they have the they exhibit the emotionally instability characteristics. See, they are going to stay in a house, stay in a cubic, and they need to see only the walls. Whenever required, we are going to enter them cubic, and we are just taking care of them. See, they feel very stressed to be staying in a single room, and visitors are prohibited in the hospital, and it's actually nurses' important task is to emotionally stabilize them. Psychologically, we should support them. That is the best medicine, I feel.
What you would like to say to general public?
So each country has its own different population region. Sorry, different population. In UK, there is elderly population is very high, and with comorbidities are also high. So don't please compare with any other country or any other state. My sincere advice not to compare. We all do our best well, and we all do our best to this well wherever we are, and be proud to be a nurse forever. And as this year theme, 2020 theme, nursing the world to health, with a focus on the true value of nurses to the people of the world. Stay safe, be safe, proud to be nurse forever.